My name's Adriene Lee and I'm currently the president of the Australasian College of Dermatologists, and my passion is looking after my patients and looking after their skin. So the Australasian College of Dermatologists, it's actually the sole medical college that's accredited by Australian Medical Council for the training and continual professional development of dermatologists. And we represent all dermatologists in Australia, so that's about 650 of us, plus our training dermatologists, of which there are more than 100. We basically oversee the training, which is 4 years of extensive training in dermatology to gain the skills that we need. The current landscape of skin checks is quite confusing, and I think it's confusing because we don't have all the answers yet, but also you get lots of different messages from lots of different sources, and it's hard to know who to listen to or what advice you take. And ultimately we're all working for that right skin check for the right person at the right time. In terms of our role as dermatologists in skin checks, we really see our role as in targeting those at high risk of skin cancers. Skin is critical not just in holding all our bits together, but it has a role in protecting ourselves, and part of that protection is also from the sun. It's something that people sort of might dismiss, but it's a very critical part of everyday functioning and activities. So of course UV is emitted by the sun, and UV has different wavelengths. We talk about a UVC, UVB and UVA. And these different wavelengths have the potential to interact with parts of our body and cause change. You can't tell by how it looks like outside. So you might look outside and say, it's not sunny today, it's grey, it's overcast, I'll be fine. It means nothing. Whenever the UV index is 3 or above, we should be protecting ourselves. It's that classic slip, slop, slap, seek shade and slide. Slip on sun protective clothing, long sleeve shirts, longer pants. I often think if you hold it up to the light and you can't see through it, that's tightly woven, so that should give you some good sun protection. Then slop on sunscreen, factor 50 plus sunscreen, that's broad spectrum. Broad spectrum means you get UVB and UVA coverage, and also reapply every 2 hours. You need to apply it 20 minutes before you go in the sun for it to actually work. Ideally use a water resistant one, and you need to apply enough. A teaspoon of sunscreen will cover 1 body part. Slap means slap on a hat, and really it should be a wide-brimmed hat. So after you slip, slop, slap, you slide on some sunglasses. UV can also damage the eyes, not just the skin, so it's important to protect our eyes really from an early age. And then finally seek shade, even if you've got all those other aspects of sun protection covered. There's certain members of our population who will be at high risk of getting a skin cancer. The highest risk is people who've had lots of UV exposure in the past, especially UV that's caused sunburns. Other risk factors include fair skin. So if you've got pale skin, freckles, blue or green eyes, blonde or red hair, you've got less melanin in the skin, and the melanin provides a layer of protection from UV penetration. Patients who've had a skin cancer in the past, also a family history of skin cancer. So if one of your first degree relatives has had a melanoma, then your risk of melanoma is actually increased by 74%. And then if you've got lots of moles, so more than 100 moles on your body, that puts you at high risk of skin cancer. If you've got funny looking moles, they're a bit bigger, they're a bit funny shape, they might have a few colours in them. Any number of those, then you're at a higher risk. I think we should check our own skin every change of season. You just need a wall mounted or a bathroom mirror, and you just look at your skin. You need to remember the bits that we often forget, so checking your hands, between your fingers, checking the soles of your feet. And actually we talk about the A, B, C, D, E rules, so you're looking for asymmetry of your spot. You're looking at the border or the edge of the mole to see if it's irregular or a bit smudgy. C stands for colours. You're looking for multiple colours, so you might see a black, a dark brown, a light brown, grey, blue. D stands for diameter, so that just means expanding diameter or growing. And E stands for evolution, so any other change in that spot. So is it getting lumpier? Is it changing in colour? Is it getting scabby or crusty? So they're the kinds of things you're looking for. You're also looking for new spots that you haven't seen before, especially again if they look different. Also looking for new, rapidly growing, firm, lumpy spots. They might be red, they can be painful. Now, if you find anything that you're worried about, and especially things that keep changing or keep causing you problems after at least 6 weeks, then you should go to your general practitioner. And your GP is equipped with the skills to assess a spot, to know if it needs more or if it's nothing to worry about. But they'll also be equipped to recognise if it might be a bit more complex or require specialist intervention. And that's when your GP will refer you up to a dermatologist for assessment.